Welcome to the Alzheimer's and Dementia Summit. I'm your host, Jonathan Landsman. Did you know that every 3 seconds, someone gets diagnosed with Alzheimer's or dementia? In fact, Alzheimer's is the 6th leading cause of death, kills more people than breast and prostate cancer combined, and Western medicine fails to offer a solution. As a health and fitness consultant for nearly 30 years, I believe Alzheimer's and dementia are the most misunderstood, cruelest, and costliest of all diseases. That's why I created this summit, to help you prevent, slow down, and reverse cognitive decline before it's too late. Our show today, the best essential oils for brain health. Our guest, Dr. Eric Zielinski, is a sought-after natural health educator, motivational speaker, and author. Inspired by the timeless principles in the Bible, Dr. Z's mission is to provide people with simple, evidence-based tools that they need to achieve the abundant life. By creating programs like Beat Cancer God's Way and hosting online events such as the Essential Oils Revolution and the Heal Your Gut Summit, Dr. Z educates people in natural remedies and empowering life strategies. Please join me in welcoming Dr. Eric Zielinski to our program. Dr. Z, welcome.
Oh, thanks so much, Jonathan. I am really, really excited about this talk and just an honor to be selected amongst your panelists.
It's great to have you, Dr. Z. You know, you've done other summits before. Hundreds of thousands of people have listened to you talk about essential oils. A lot of people are also familiar that you are a trained public health researcher. What do you see with all of your work as the biggest health issues as it relates to Alzheimer's and dementia?
You know, Jonathan, I came into this interview prepared for this talk, I thought. And then as I did research and I was really digging into the literature, I was really shocked to find that there are actually 5. You know, you already mentioned that we're at pandemic proportions. I mean, this is beyond epidemic. Like, this is a huge problem we have on our hands. And you also mentioned about the fact that there is no known medical cure. We have misguided pharmaceutical intervention. That's kind of what I was thinking of going into this discussion. But I found 3 other things that really kind of rocked my mind, was that there's a direct connection with sanitation overkill, sedentary lifestyle, and overstimulation. Really, the lack of peace and calm in our society. And to me, these 5 things are the public health concerns that we need to start addressing at the legislative level. And until we do, this is not going to stop. And there's so many things that we can address. So I want to address, if we have time, I really want to touch base on each of them to really set the stage for this, because most folks are not familiar with the fact that Alzheimer's is in the position that it's in. How many people are getting diagnosed as quickly as they are?
It is out of control, Dr. Z, and you're right about having this on a federal level mandated would be great. Probably not something that we're going to see in the United States, but we know for a fact that when we're reducing stress, we go to universities out in the Midwest of the U.S. that actually put this into play, where children are asked to do meditation 3 times a day. Children that are eating healthier, real food, not the junk food that's in most of the public schools. All of these things, from food, meditation, or lifestyle habits, we see that these children are really, really healthy. They're mature, they're well balanced, their stress levels are down. We know that high stress is increasing the risk of Alzheimer's and dementia. We know that all these other toxins that are in our environment are increasing our risk as well. And yet again, on a federal level, we see that all of that is allowed still. It's absolutely crazy, especially when you look at the research, no?
You're correct. And so what I'm really hoping and praying is that people listening, because I know that public health officials are listening right now. We have tens of thousands of people listening to this interview. So folks, I'm going to challenge you, especially if you're a researcher, if you're an academic, if you have any scope of influence, listen to this data and be motivated that we can, as a united country, as a united people, we could stop this. We really can stop this in its tracks. So first and foremost, as you mentioned, Jonathan, we are at pandemic proportions. What we have is Alzheimer's is rapidly becoming a primary cause of death all across the world. In fact, it's the only disease, according to statistics, it's the only disease among the top 10 causes of death in the U.S. that is supposedly not able to be cured, prevented, or slowed. So basically, once you have it, you always have it. And that's what a lot of folks even talk about heart disease, which we know is completely untrue. So I want to debunk that myth, because currently right now, 700,000 people in the U.S. over 65 have Alzheimer's, and they die because of Alzheimer's. That's 700,000 people die because of Alzheimer's every year if they're over 65. Now, this is interesting, I felt, is that between the year 2000 and 2013, deaths attributed to Alzheimer's increased 71%, while those linked to heart disease decreased 14%. So at the rate that we're at, this is going to go crazy out of balance. I mean, just think about that, 71% increase in deaths related to Alzheimer's. So right now, about 5.3 million Americans of all ages had Alzheimer's in 2015. Of this, 5.1 million are age 65 and older, which is interesting because at least 200,000 individuals, Jonathan, under the age of 65 with what's known as younger onset Alzheimer's. So we're seeing it. Not only is it becoming more deadly, but younger and younger people are getting it. And when you look at the demographics, it's shocking to see that 2/3 of Americans with Alzheimer's are women, and older African Americans and Hispanics are more likely than Caucasians to develop Alzheimer's and other dementias. Okay? And so they're expecting this just to rapidly, exponentially increase because our life expectancy as a nation continues to climb. And in a sense, it's becoming like almost an inevitable consequence of getting old. Like, that's my gift. Hey, you're 65 years old, you're going to have dementia. That's what they're presenting it as. Hey, here's your gift of getting older. But that's so not true. As of right now, by 2025, if nothing changes, we're going to have a 40% increase of people with Alzheimer's, which could be 7.1 million people. And by 2050, if we don't change and stop the trend, it's going to triple. So that's the number one issue, public health concern. Number two is there's no medical cure. And according to researcher and Harvard Medical School fellow, Dr. Rebecca Irwin-Wells, we know that approximately 50% of people diagnosed with mild cognitive impairment, which is the intermediate stage between the expected declines of normal aging and the more serious cognitive deterioration associated with dementia, may develop dementia within 5 years. Unfortunately, we know that there is, according to Dr. Wells, no FDA-approved medication that could stop the progression. We also know that as people age, there's a high correlation between perceived stress and Alzheimer's. So, we wanted to know if stress reduction through medication might improve cognitive reserve, but there's really limited research being done in that. And to me, the kicker is if we know that medication cannot work, then why are we mass producing pharmaceutical intervention and giving it out? It's almost like, I call it misguided pharmaceutical intervention. And I like to look at the United Kingdom, the UK, as a good case study to understand this. There was a study published in 2012 in the British Journal of Psychiatry, where they discovered up to 25% of people in the UK with a diagnosis of dementia are prescribed antipsychotics, which are flat out proven not to help at all. So according to one study, the potential risk of such treatment are becoming clearer. Like, the risks are becoming clear, but the benefits remain uncertain. So there's this cloud of uncertainty because currently right now, 800,000 people in the UK have dementia. That's unbelievable. And 80% will, during the course of their illness, exhibit what's considered non-cognitive symptoms and behaviors such as agitation, aggression, psychosis, wandering, sleep disturbance. And so what do? They just put these people on antipsychotics, which is unbelievably irresponsible, in my opinion. Because the bottom line, antipsychotics are not the answer. Why not we investigate some proven solutions like frankincense oil, lavender, chamomile, vetiver, and especially the citrus oils? And we'll talk more about that later, I'm sure. But there are solutions to the antipsychotics. So those are the two things that we've discussed, misguided medication and just the pandemic. But what about sanitation overkill? And Jonathan, this is what threw me through a loop. I couldn't believe what I was reading about the direct connection between the imbalance of the microbiome, especially the skin microbiome, and the preponderance to developing dementia and Alzheimer's. New research from the Oxford Journal has found a strong link between wealthy, sanitized countries, such as America, Australia, the UK, you name it, and a higher rate of Alzheimer's. This new research was led by Dr. Molly Fox across 192 countries, and it suggests that a lack of exposure to bacteria creates a poorly developed immune system, leaving your brain at risk for inflammation. So countries with a higher degree of sanitation and a lower degree of pathogen prevalence have a higher age-adjusted Alzheimer's rate. So it all boils down to the human microbiome. because we have found that Alzheimer's shares certain etiological features with autoimmunity, which has a direct effect with the microbiome. We have seen that ad nauseum over and over again. So prevalence of autoimmunity varies between populations, right, in accordance with the environmental microbial diversity. I guess the bottom line is this. We can't be so clean. We are obsessed with hand sanitizers, antimicrobial body care products, and they're annihilating our skin microbiome, which is leading to direct decrease in immune function, which is leading to brain inflammation. Who would have connected the two? Well, what's the solution? I'm a firm believer, do it yourself, and especially essential oil-based products, because essential oils are all antimicrobial, and they're a great solution to the stuff, the lotions and the potions and the thing that we buy at the store. So to wrap up the public health concerns, the next one is sedentary lifestyle. And this is kind of interesting, too, because a recent study published in the British Journal of Sports Medicine shows that regular physical exercise, even later in life, can prevent chronic conditions like diabetes, heart disease, and cognitive impairment. So researchers from the University College of London followed 3,500 seniors for 8 years. This was a longitudinal study. This is no joke. They found that a high correlation between the amount of exercise participants completed and their health was very apparent. So what they did was they did a self-reported physical activity assessment in 2002 and 2003. Then they followed through with them for the next 8 years. And once they did a healthy aging assessment 8 years later. And that was really, it's kind of interesting. It was defined, being healthy, if you aged well, it was defined as those participants who survived without developing major chronic disease, depressive symptoms, physical or cognitive impairment. So after this 8-year study, they found that 19.3% of the sample was defined as healthy. I mean, that's very low comparatively. I mean, what happened to the other 81% of these people? In comparison with the inactive participants, people that had moderate or vigorous activity at least once a week was associated with healthy aging. And I love this quote from Mark Hammer, Dr. Hammer, who was the lead investigator. He says this, the bottom line is the take-home message really is to keep moving when you're elderly. It's not about getting your 60 minutes of exercise on the treadmill. It's about a way of life, right? So for him, it's a cliche, but it's a case of you use it or you lose it. You do lose the benefits of exercise if you don't remain active. And the researchers concluded that this study supports the public health initiative that we need to engage older adults in physical activity. So when you go to countries like China and other countries that incorporate their elderly as a way of life, their elderly are part of the way of life with raising the children, the grandchildren. They're outside, they're moving with the Tai Chi and the meditation that they do. And we need to start adapting those procedures and practices all around the world. So here's it, folks, this is key. Especially when we're talking about prevention, stay active. And especially if you're elderly, walking, gardening, especially supervised weightlifting, swimming, and water aerobics are all going to help. So the last public health concern, Jonathan, I want to talk about is overstimulation. This is a big issue now, especially when we're talking about electromagnetic frequency, which I know you're talking, I have another expert on your summit, so I'm not going to address that too much. But we live in this hyper-stimulated environment where it's almost virtually impossible to be in a dark, quiet place anymore. You almost have to lock yourself in the closet. I mean, come on. We are just stimulated with sounds and musics and TVs and just everything, smells. I mean, it's, again, go back to nature, getting out 10 miles into the woods, then you can get peace and quiet. So what we have found, a 2013 study from Beth Israel Deaconess Medical Center has shown that meditation plays an important role in slowing the progression of Alzheimer's and dementias. So they took 14 adults between 55 and 90 years old, and they divided them into two groups. One group received regular care with no emphasis on meditation, while the other group meditated and performed yoga just at least 2 times a week, 2, 3, 4 times a week. Researchers found that the group who meditated and practiced yoga, at least what they determined 2 hours per week, had less atrophy in parts of the brain and better brain connectivity than the control group. So for me, when it comes down to essential oils and natural-based therapies, it's like utilizing things like frankincense, lavender, chamomile, and even vetiver to help calm the brain so we could focus on meditation, because a lot of us struggle. You know, you put yourself into a dark room and put on your meditation music, or you just have quietness. Most people can't even handle that. We become unnerved. We don't know what to do. But we have found that even diffusing those frankincense, lavender, chamomile, and vetiver oils can really just help calm and help us put in a state where we're not going to fall asleep.
Dr. Z, this is great information. As we're doing this interview, I've got frankincense right next to me. So it's just amazing that you're talking about all this. And it really does make a difference, everything that you're talking about. I know this is your area of expertise when it comes to essential oils. So please tell us what the research is saying to you about the brain health benefits of essential oils.
Well, I want to talk about dementia, Jonathan, because there's been some good research regarding that. Unfortunately, though, like most topics in natural therapies, there's not a preponderance of research on the topic. And that's a shame. As you know, most funded research goes towards the pharmaceutical model, and we got to scrap and scrape every penny. So when we do rub two pennies together and get a gem of a study, however, we have folks like Professor Elaine Perry, who is doing research currently. So I have to give her a plug because she's a professor of neurochemical pathology at the Institute for Aging and Health in Newcastle, the Newcastle General Hospital. And she's currently involved in a multi-centered trial for aromatherapy for people with Alzheimer's and agitation. And so we have it out there. We're just waiting on the results. But in the meantime, again, this will be one of the largest studies that we have to date. But in the meantime, Professor Perry substantiated the need for this kind of research by referring to the several trials that we have. And they're smaller, 120, 40 people, whatever it might be. This isn't like a mega thousands person study because that costs tens of thousands of dollars that are just not in our budget. So when we look at controlled trials of aromatherapy and dementia that have been initiated, it's very promising. Because, according to folklore, linen bags were filled with lavender flowers and placed under people's pillows to help facilitate sleep. So one trial that we see in the literature actually showed that the use of lavender increased sleep patterns of dementia patients who were in residential care. Now, another trial involving 122 non-demented patients in intensive care, massage aromatherapy using lavender was well received, and the greatest improvements being mood and reduction of anxiety. So when we're looking at specific oils, I found an interesting study about lavender, geranium, mandarin, all in an almond oil base. And this was applied to the skin of 39 patients. And what they found was it resulted in increased alertness, contentment, and sleeping at night. And again, it reduced levels of agitation, withdrawal, and wandering. And those are the big things, Jonathan: agitation, withdrawal, or wandering. Because if a dementia patient or Alzheimer's patient presents these, especially in a facility, what are they going to do? Going to put them on antipsychotics, and then they're going to drug them up, and then this is going to make the whole cascade worse because they're not going to exercise, they're not going to have their brain stimulated, and then they get worse and they're never going to recover. So we want to keep people off of drugs. So in a recent open label trial on people with dementia, they used ylang-ylang, patchouli, rosemary, peppermint, and they found that it produced a marked decrease in disturbed behavior in the majority of participants. And here's my favorite part: it reduced prescription medications in this trial. Love it. That's what we want to see. We want to see less people on drugs, more people utilizing the aromatherapy, whether it's skin application or diffusion. I love it, love it, love it. Now, there have been several studies on lavender. Again, we mentioned that we will continue because that's a common thread with this topic, and also lemon balm, also known as Melissa. So lemon balm and lavender aroma was introduced to 6 patients in one trial compared to a control group using sunflower oil as a control. And they found that it actually increased functional ability and communication and decreased, quote, difficult behavior. Again, these are the key words, Jonathan, we're seeing over and over in the literature. So when you look at, quote, difficult behavior, what do you do to a difficult patient? You drug them. And that's what we got. That's another public health concern, is we need to be more responsible. So when we have lavender, again, aroma and massage, 22 patients were comparative to a massage alone or aroma alone. And they found that aromatherapy with massage significantly reduced frequency of excessive motor behavior, like twitches and other things that would be considered something that someone shouldn't be manifesting, or even agitation where people can't sit down. They just need to relax. And we could go on, but some of the things that I found, especially with Melissa, and I want to end with this, Melissa being lemon balm, has helped patients specifically overcome social withdrawal. And I think that is very, very key, because a lot of folks in this space, a lot of folks diagnosed with any sort of dementia, they find themselves lost in the world. It's almost like somehow on the autism spectrum, like how these people are just left alone, wandering. Their minds are just alone in a corner. And my mind goes to visiting my grandfather who died in a nursing home and seeing, the old folks just sitting in the corner, just staring in oblivion. I mean, completely withdrawn, completely not even living a life worth living. And, even utilizing Melissa, a lemon balm oil applied to the face and arms of people can help that, right? So why not try this, folks? Another cool study evaluated marjoram, patchouli, and vetiver, and they, again, applied a cream over the body and limbs of patients. And they found that it increased the mental state. And it also, and this is interesting, according to the study, it increased resistance to care. So you got to think about that. Resistance to care. So are we creating more independence? And no wonder most physicians don't recommend essential oils. I mean, if you think of it, if we're going to have resistance to care, resistant to the medical mindset of, hey, we're going to treat you like a vegetable, of course we're not going to want these people drugged. So that is, again, a number one concern with the whole thing. So, Jonathan, I don't know if we have time, but we can talk a little bit about the pathophysiology or maybe even why essential oils work. I'll give you that call because there is research, but the bottom line is this: it's debated. We don't know why specifically. So I'll give you that call if you want to transition into something else or if you want to go into the physiology of it.
No, I really like the idea of talking about why they help so well. But, Dr. Z, just a quick little comment about so many of the fantastic things that you just said. I just shake my head as I'm visualizing when you were speaking how disconnected most conventional facilities are to your message today. I mean, I just pray that more people will hear what you have to say. When I go to any of these senior homes, assisted living places, when I drive by these places, you can see through the window, these people are doing exactly what you're saying. They're sitting around, they're left ignored essentially. Sure, they get moved from one room to the other. They're eating all kinds of sugar, artificial sweeteners, processed foods. And then we want to know, why are these people who don't feel well as it is, why are they agitated? Why don't they feel well? Why are they complaining? And then, of course, they get drugged because they're a little out of control, and we have to control that population. It's just this vicious cycle that's going on, and no one's thinking about all of these healthy things. They're not hearing about it in Western medicine. It's not being presented to these caregivers at all. This is the message they need to hear so much more, no?
I agree. And, we learn this in school about something we don't hear about a lot. We hear a lot about child abuse, spousal abuse, but what about the mass amount of people that are elderly that are being abused? And this is abuse. This is elderly abuse. And this is just as bad as child abuse. This is just as bad as spousal abuse. Abuse is abuse, folks. And we need to step up and we need to fight for the rights of our elderly. And most cultures used to admire and esteem elderly as the prized possession of the nation. We've marginalized the elderly as a burden. And that's a shame. It breaks my heart. It really does. So I take this to heart. I want to love and support people, especially in this demographic, because they need people fighting for them in their corner, Jonathan.
Dr. Z, let's go into it because I'd really love to hear what you have to say about why this is working for people with Alzheimer's and dementia. Talk about it a little bit, please.
So how does it work? According to Yale Scientific, an article, there's something to be said for the consistent mood improvements across studies. So when you smell oil, some molecules literally dissolve. It's called volatile organic compounds. They dissolve in the mucus lining of the olfactory epithelium in the roof of your nasal cavity. So basically, your nose is lined with millions and millions of nerve cells. So there, the molecules stimulate the olfactory receptors. So the olfactory sensory neurons carry the signals from the receptors to the olfactory bulb, which filters and begins processing the inputs of the lemon scent. Now, they get a little geeky, but we'll finish this out for some folks that are studying this. You might find this interesting. The mitral cells then carry the output signals from the olfactory bulb to the olfactory cortex, which allows you to perceive and recognize the tangy scent of lemon. So interestingly, the mitral cells do not lead to the olfactory cortex. They also carry the signals from the lemon scent to other areas in the brain's limbic system. So they don't only lead to the olfactory, they affect the limbic system, which is the direct center for learning, emotions, and memory. So that's why, Jonathan, if you've ever smelled a scent maybe from an old girlfriend, it always happens to me. I remember my first girlfriend. I remember the perfume she wears. And whenever I run across a woman that wears it, I remember Becky. I just do every time. I just remember my first girlfriend. So, Interestingly, though, and this is where it gets tricky, this is somewhat debated in the context of dementia and Alzheimer's. And this is the take-home message, folks, because this is why I want to talk about application in a minute. Because although it might be thought that aromatherapy works by providing the pleasing smell, many patients with advanced dementia have lost their sense of smell. So how does this explain? Right? How does this explanation, according to Snow and other researchers, Snow being a researcher, a purely olfactory form of lavender aromatherapy had literally no effect on agitation in people with dementia, while application of a skin lotion with lavender was effective. So this leads us to believe that transdermal application is necessary. So with folks with advanced dementias, with Alzheimer's, you need to consider more than just aromatherapy. You need to consider safe lotion and safe approaches to getting it on people's skin. When we talk about Alzheimer's disease, there was a study in Psychogeriatrics in 2009, and they looked at aromatherapy. Again, this was aromatherapy, and it was a good study consisting of rosemary and lemon, essential oils in the morning, and lavender and orange in the evening. Now, every patient, which is kind of rare to find 100% improvement, every patient showed significant improvement in personal orientation related to cognitive function. Now, patients with Alzheimer's specifically showed significant improvement in what's known as a touch panel type of dementia assessment score. And this is the kicker. Routine laboratory tests showed no significant changes, which means this: there were no side effects. So this is, again, proof that essential oils have virtually little to no side effects. But this is interesting, too. A caretaker self-examination known as the Zaret score showed no significant changes, suggesting that caregivers had no effect on the improved patient. So this is basically isolating it just to essential oils. So, how can really essential oils help people with Alzheimer's and dementia? It's really all about, to me, we need to focus on a couple things. We're thinking about grandma, grandpa, even ourselves. If anyone listening is on the spectrum of Alzheimer's or dementia, my number one recommendation is to keep moving. Keep moving. Now, I don't necessarily purport exercise, like, again, going to the gym for 60 minutes. This is a way of life. But if you are exercising, I love that. Again, that's a great thing. You could go water aerobics. You can go on the treadmill. Gardening is a fantastic exercise. Hiking. And there's a study, Jonathan, 2 studies, in fact, in Iran that evaluated the use of peppermint oil to help increase athletic performance. And the nice thing about this is I've found a common denominator with the elderly is shallow breathing. And this is just from basic gravity, how the weight of the world has been weighing down on them. And a lot of folks have what's called upper cross syndrome, where their backs are hunched over, their shoulders are over, they're not getting good deep breaths. So anything to help an elderly person breathe better is good. And so even literally putting a drop of peppermint oil in water, or putting a drop of peppermint oil, I know you and I have talked about this, can help elderly breathe better, which can then help them even have the energy to want to exercise or move. And the other aspect of essential oils is a common denominator with the elderly is pain, soreness, right? And so when we're looking at an elderly person doing something, I can't, my back hurts or my knees hurt. Well, why not utilize natural therapies like anti-inflammatory oils to help calm inflammation, like wintergreen, chamomile, peppermint, even frankincense. A lot of these oils can help calm. And of course, the fir needle, like white fir, birch, and anyone else that has like an evergreen needle, those are great analgesics. And also to think about for people currently, in the context people currently with Alzheimer's or dementia, I really want to encourage people to calming the overstimulated brain. And a lot of elderly folks, and I just, again, go back to my grandpa because it's such a vivid story. He was one of the closest people to me in my life. So I saw my grandpa literally die in his lazy boy. He watched TV for the last almost decade of his life, and he just spent, I can't even imagine, if I had to guess, literally almost every waking moment of his life in front of the TV beside the restroom and sleep and all that. So we need to, step back from that, and we need to go back into reading. We need to go back into being quiet. We need to go back to calming the brain. And so, when you talk to people about rest and relaxation, peace and calm, you always get lavender, chamomile, vetiver. These are the go-to oils. But according to a 2009 article published in the journal Natural Product Communication, we have to consider these: rose, orange, bergamot, lemon, sandalwood, clary sage, and what's known as rose-scented geranium. So, folks, here's the bottom line. Basically, any oil that can help you or an Alzheimer's patient reach a state of peace and calm, that's what you need to use. And so there is no recipe, but you again can try, a lavender-based lotion, a lavender in your essential oil diffuser, and you could try that and see how the person responds or how you yourself respond. And if you don't respond well, or if your patient or if your loved one doesn't respond, they still seem agitated, well, play around. Try chamomile, try vetiver, try these oranges and citruses and limes and just see what happens. Because what we have found was that people who literally practice meditation and yoga have less atrophy in the hippocampus, which is shrunken in people with Alzheimer's. So we need to focus on meditation, whether it's prayer, whether it's scripture reading, whether it's just getting peace and quiet and thinking about positive things, because meditation literally protects our brain by increasing protective tissues. Because one thing we have found that meditation specifically can help seniors feel less lonely and isolated, which are two feelings which lead to an increased risk of developing Alzheimer's. So if you're a widow or a widower, being alone and isolated, number one, is one of the worst things you could do. So get involved at your local community center, your local church, be with your peers, be with your family, and find yourself. Try to meditate, folks, because it reduces the stress cortisol. Because here's the problem with stress. I don't want to go into this too much, Jonathan, but stress has a direct relation to dementia, and we need to do anything we can to slow that down.
Dr. Z, we have lots of healthcare providers who are listening to this program right now. We've got a lot of people who are just concerned about their own brain health as well. I would really like to get from you some of these tips on how to best use essential oils, especially if we're looking to keep Alzheimer's and dementia at bay.
So if we're focused on preventing, like we just mentioned, stress, we can't forget, again, the exercise. So we need to be moving. We need to constantly be moving in motion. We need to, as much as possible, keep the brain calm, reduce stress as much as possible, because it is virtually impossible to live a stress-free life today. Yet, in addition to that, we need to stop in its tracks what are the most common risk factors associated with Alzheimer's and dementia, which is microbial imbalance. Essential oils, in my opinion, are the number one solution to stopping the sanitation overkill pandemic. We need to stop. And to me, this is somewhat one of those extreme things. Like I'm telling people, like, stop today. No more hand sanitizer. Stop today. Any lotion or potion or soap or anything that has antimicrobial in it, you don't need it. We don't need it. We don't want it, because we have found that literally it just annihilates our skin microbiome. It decreases our immune function, leads to brain inflammation, and that is just another contributing factor. And to me, Jonathan, that's the number one thing, is because it's becoming virtually impossible to even go to like the restroom at the gas station and find soap that isn't tainted with antimicrobial products like triclosan, which has been a registered pesticide since the late 1960s. I mean, we're putting pesticides on our skin, folks, and we don't even know it. So my suggestion is we need to do it ourselves as much as possible, or buy a product from a trusted source that utilizes natural solutions like essential oils, because all essential oils, veritably all of them, are antimicrobial. And here's the kicker with that, is they have what's known as self-selectivity. So if someone's utilizing an essential oil-based product to wash their hands, or even as a hand sanitizer type of product, if you're on the road, I get it. I got 3 kids. My wife is pregnant with baby Z, number 4. I know what it's like being on the road, on a road trip, and having messy hands everywhere. I get it. Water sometimes doesn't work. You need a little bit of oil and fat, but you're not going to get soap in the car. Well, that's where hand sanitizer is convenient, but why not a natural version of it, right? Because what these oils have is what's known as self-selectivity, Jonathan. And that's the real interesting thing, is these oils target specifically the pathogenic bacteria and the viruses and the fungi that could hurt us, and they leave the healthy probiotic, the good bacteria, alone. And so that is just a brilliant way of God's design to keep us healthy and strong by really doing it ourselves.
Dr. Z, this is the part that's going to get super exciting, as if the rest of your presentation hasn't been absolutely amazing. I so appreciate your time. Talk about some of these do-it-yourself essential oil recipes that you have. People are going to want to really take notes for sure.
So, do-it-yourself deodorant. And we haven't even discussed the aluminum connection. And I'm assuming, correct me if I'm wrong, I hope you have an expert or two. I'm assuming you do, talking about aluminum, right?
We absolutely do.
Cool. Folks, aluminum's bad news bears, especially when your deodorant is an aluminum-based product and you're putting it into your armpit, your axilla, which is directly connected to so many different lymphatic nodes. And we have found that the connection is profound. You want to stay away from aluminum at all costs. And if you cannot get a good aluminum-free based deodorant, then here's a good solution. You take 1/3 cup coconut oil, 1/4 cup baking soda, 1/4 cup arrowroot powder, and 4 tablespoons cornstarch. And then you could get up to 20 to 30 drops of essential oils. It could be anything you like. I mean, really, it could be, you can have fun with it. We like tea tree, lavender, frankincense, myrrh. I mean, you could do anything you want. Have fun. Enjoy a scent. Sandalwood, cedarwood for the guys, because I'm sure guys don't want to smell like flowers all the time. So what you do is you combine the dry ingredients first. Then you add the coconut oil, and you add your essential oils, 20 to 30 drops. And then you add more dry or wet ingredients as necessary, and you store in a jar or a roll-up tube. It's that simple. You just put it together, you mix it, and you apply it as necessary. And this is a deodorant. It's not an antiperspirant. You know, God gave us sweat glands for a reason, everyone. We want to sweat. But I understand we don't want a foul odor, so that's where the deodorant comes into play. So let's talk about DIY essential oil soap. Now, this is a really simple soap that could be made by mixing ingredients into a glass dispenser. You could take 1/4 part, again, you have a glass dispenser, so 1/4 part Castile soap, 3/4 parts water, and let's say 5 drops of an essential oil or a blend. It could be anything. Again, peppermint, citrus ones, tea tree is always a favorite. Eucalyptus, you can get creative and do whatever you want. I mean, there's some called arbor vitae, which is the tree of life. Just enjoy it, folks. Again, these are just a guidance. You get the base, and then you can make them really quick. And Jonathan, you and I discussed this at length about oral health. We can't forget oral health is much more than cosmetic. You know, most of our products, again, are filled with chemicals, antiseptic mouthwashes. These chemicals are killing our mouths, our microflora balance, and that has been led to heart disease, blood pressure increases, and you name it. So a nice essential oil-based toothpaste recipe is pretty simple. You take equal parts baking soda and coconut oil. So I suggest starting with a 1/4 cup, 1/4 cup each is a good start. Then you take 1 to 2 teaspoons of sea salt. You can take 5 to 7 drops of essential oil, and you can add, my favorite is stevia, 1 to 2 teaspoons of stevia and bentonite clay. You mix and place them in a jar or a squeezy bottle, and you use a spoon or a disposable wooden scoop to get the paste out so you avoid contamination. And when it comes to oral health, I highly recommend clove. By far the #1 oil for any sort of oral health condition. I love clove. I just add a drop to my toothpaste because I have a good toothpaste. I put a drop in my toothpaste, and that's my oral solution every day. I think I got 2 more. Shampoo. This is a big issue for a lot of folks because we don't recognize, folks, our skin is the largest sponge in the world, and our skin will literally absorb like 60 to 70% of the chemicals that we put on it or in it because of what's on the lotions or potions or even shampoo. So a very simple shampoo, which we can't overlook it, is you take a 1.5 cups, which is roughly 1 can coconut milk, a 1.5 cups of liquid Castile soap, and then 40 drops of whatever oil you want. Again, lavender's good, peppermint's really nice. You could go on and on and on. There's so many different solutions for you guys. You mix it well, and you add to a BPA-free squeezy bottle, and then you shake before use. I mean, what better can you get? I mean, it hydrates your hair. It leaves your hair smelling nice. And then you can kind of go fun if you're a woman, if you want a nice floral scent, clary sage, lang lang, jasmine, rose. I mean, you could really get, especially if you want to set the mood for libido. There's so many different things. That's a whole nother topic, Jonathan, is the elderly and libido. And, just so you know, folks, you can have an active love life even into your elderly age, and utilizing aromatherapy can really help. So the last recipe I got is hand cream. Lotion making techniques, Jonathan, vary from really simple to complex. So I want to give folks, again, if you want a simple one, just coconut oil with some essential oils. That's pretty straightforward. But if you want like a nice cream, this is a little more advanced. But for people that are do-it-yourselfers, I think you'll appreciate this one. You could get a 1/4 cup shea butter, 1/8 cup sweet almond oil, 1 tablespoon beeswax. So you carefully melt these. Then you add 20 to 30 drops of essential oils. You stir. You pour into a sterilized jar, and then you can adjust the amount of beeswax for firmer or softer lotion. So I would recommend trying nourishing oils like chamomile, citrus, myrrh, lavender. These are very healing, especially if you're battling eczema or any skin condition.
Dr. Z, absolutely incredible information. Every single interview I have done so far for this event, it's just amazing to hear all the information. I just think in the back of my mind, there is no excuse anymore. The information is there. It's in the research. It's in the medical literature. We know what to do. There's a big disconnect with conventional medicine not taking this, looking for it themselves, and putting this into play. But Dr. Z, you really nailed it today. You gave out a lot of great information. As we close out the program, I know you have a special message of hope. Please talk about it.
Thanks, Jonathan. And I really wanted to thank you, too, very sincerely, on behalf of everyone listening, on behalf of the other panelists. Being a telesummit host, I know the time and the energy and the expense, and just thank you. I mean, this is something that's very needed at this point. No one's done this at all. And just thank you for rising up, man. We need to stick together. So other folks in the health space, whether you're a blogger, whether you're a physician, let's applaud Jonathan. But not only that, let's shoulder the burden, because we need to work together as a team, everyone. And that's really my message to everyone out there listening, whether you are a physician, a blogger, or whether you're someone who isn't in that space. This can stop. And I believe wholeheartedly, and I've seen it time and time again in all my own practice, my own research, everything, that God has given our bodies the unbelievable ability to heal itself under the right conditions. We need to stop the toxicity, and we need to increase what we could do to promote life. And that's food, that's natural therapies, that's the lotions and the potions, that's everything. So folks, I want to encourage you to take this message seriously and go baby steps. I want to give you the hope that you could change slowly but surely. Don't feel like right now you got to go make every one of the 5 or 6 recipes I gave you. Whatever motivated you, go do it. Start small, celebrate your successes, work with family and friends that support you, and let's beat this thing together, because God willing, we can.
Dr. Z, I want to thank you so much for your time, and I want to thank our listeners for joining us today. If you would like a copy of this program plus all the other presentations inside the Alzheimer's and Dementia Summit, simply click the banner you see on this page. Thanks again for attending the Alzheimer's and Dementia Summit. Talk to you soon. Take care.